Hello, this is Miss Pritchard, and I'm going to tell you a bit about the BTEC Tech Award in Health and Social Care. The Tech Award is a vocationally based course that explores areas of health and social care in the country, and you can actually achieve this at level 1 and level 2, although we do tend to focus just at the level 2 criteria. And the table below gives you some idea of how the grading of pass, merit, distinction and distinction star roughly equates to the GCSE grades. So a level 2 pass and BTEC is equivalent to a level 4 at GCSE. So the course is made up of 3 components. The first 2 are taught in year 10 and they are coursework based. Component 3 is taught in year 11 and there will be an exam externally set in the February of year 11, and that allows students to retake that exam in the June of the same year. Okay, so I'm going to go through all the components and give you some idea of the content. So component 1 is we look at human lifespan development and how we develop over life stages. So I've listed the life stages there. When we talk about development, we look at not just physical development, but how we develop socially, emotionally, and intellectually. So we then look at, as we develop over our lives, what are the factors that can have an impact on our development? And they can be both positive and negative. And students will generally pick a person who they know, or it could be a member, a celebrity or someone in the news who they're interested in, and they will use that person to write their coursework. So they'll write about how that person has developed through 3 life stages and various factors that have influenced them. And the second learning aim is we then look at life events, specific expected or unexpected events that can have a significant impact on our development. And we focus on 2 case studies. One is where 2 people have a traumatic accident that results in physical injury, and the other one is about 2 young girls who commit a crime and end up in a youth offenders institute. And we also explore the areas of support and how support can help them overcome those events. Component 2 focuses more on the specific health and social care services that we have in this country. So we look at the area of primary health care, which is the first point of call, so your GP surgery, your opticians, dentists, pharmacists. And then we look at what happens if you need further treatment, if you have to go to hospital, or if you have to have extra specialist support. And then we explore the sorts of barriers that would prevent people from accessing services. The second part of component 2 focuses more on what kind of characteristics and what professional practice you need to demonstrate if you work in health and social care. So if you're caring for people, you have to abide by certain principles which are referred to as care values. And part of that you actually have to demonstrate in the form of a role play that you can demonstrate the values required to work in health and social care. Component 3 is the exam component. It's called a synoptic component because it brings together themes from the previous 2 components. So we look more again at things that can affect our health and well-being. We look at measurements of health, and then students are required to start looking at planning, health and well-being planning. How can you advise somebody who may have a number of health issues on how to improve, and what possible obstacles prevent people from following these plans? So progression with this course, it's a popular course, and we offer it at level 3 in the sixth form, which is also very popular. It goes well with A-level psychology. If you're interested in the nursing professions, you should really study science with this. Also had students do it with sports studies because they're interested in maybe going into physiotherapy or sports therapy, business, many subjects it works well with. And there's a list of some of the potential job opportunities. Last year I had 2 students go to Hertfordshire University to study paramedic science, nursing professions in general, healthcare assistants. I must stress that it is not a childcare. Well, no, at this level, childcare is a potential career progression. If you're interested in childcare, after doing this course, you should maybe look at childcare at level 3 in particular. Counselling, youth and community work, therapists, and I have had students go into the police after studying health and social care, because remember, it's about working with people and being able to understand, empathise and communicate with people. Okay, thank you very much for listening.